When measuring your ranges of motion, we noticed a few issues with some of the movements. For the more severe stiffness, you had 37 degrees of neck flexion, 50 degrees of left neck rotation, and 58 degrees of right, and 110 degrees of shoulder abduction. For moderate loss of motion, you had 23 degrees of back extension and 48 degrees of neck extension. You had two motions in a normal range. Lateral neck bending, with the left being 40 degrees and the right 37, and back flexion with 85 degrees. To track your progress, your physical therapist will measure your ranges of motion and perform a deep neck flexor (DNF) muscle test every 2 to 4 weeks. You will be asked regularly about daily pain on a scale of 0 to 10.
Hi crew, we know your patient goals are to improve your quality of life through your activities such as hanging out with your grandkids, gardening, and going on trips with your husband.
We have some suggestions to help you complete your goals, including physical therapy. It is most optimal for you to complete these sessions at least 2 times a week and do at-home exercises every day. We expect your physical therapy to take 3 to 5 months depending on your progress. In the short term, we expect you to experience pain relief, calming of inflammation, and possible soreness. It is best for you to complete these exercises every day, although if you experience pain, you can complete these fewer times a week. In the long term, although your condition can't be cured, we expect you to experience pain relief, which will allow you to experience a better quality of life overall.
Other specialists that will assist in your recovery are
a neurologist specializes in the nervous system and can treat issues caused by the spinal stenosis. Throughout the care plan, if you feel the need to talk to someone, you can talk to a psychiatrist who specializes in mental health. In your histology, we found something in your tissues worth examining further, so we're referring you to an oncologist who specializes in diagnosing and treating cancer to help you further.
muscle areas that we are addressing are your neck and back muscles. We are also looking at your bones, which include your cervical vertebrae.
There are 3 exercises we recommend you do.
The first exercises are shoulder shrugs, and these target the trapezius muscles in your back. Shoulder shrugs strengthen muscles in your back, which allow for more shoulder abduction. Each rep should be held for 5 seconds, and you will be doing 2 sets of 10. If this is too painful, you can do backward shoulder rolls and 10 reps of those. Your next exercise is neck rotations, which target your sternomastoid and splenius muscles. This exercise stretches your neck muscles, which allows for a greater range of motion. Each rep should be held for 10 seconds, and you should do 2 sets of 10. If this is too painful, you can do a modified exercise like isometric neck exercises. She places pressure on the posterior side of her head and pushes back. She then places it on the anterior side of her head and pushes forward.
The last exercise is chin tucks, which target deep cervical flexors and scalenus posterior, anterior, and medius.
Chin tucks will target your neck flexors and extensors, which will increase your range of motion.
Each rep should be held for 5 seconds, 2 sets of 10.
If this is too painful, you can do a modified exercise of chin tucks while laying down. Hold for 5 seconds and do 10 reps of these.
You can take medication to alleviate your pain, wear a neck brace for support, and eventually surgery if symptoms do not improve.
Cervical spinal stenosis is the narrowing of the space in the spinal canal. The spinal canal is a tunnel that runs through the vertebral column, or the spine, and holds the spinal cord. It can be congenital or acquired. Acquired spinal stenosis is more common, affecting 89% of people by the age of 50. Less space in the spinal canal can constrict the spinal cord. This constricting and pinching of the spinal cord can lead to pain, numbness, tingling, and weakness in the neck, back, arms, legs, hands, and feet. In your case, your cervical spinal stenosis stems from osteoarthritis. This is when the cartilage between the vertebrae wears down, causing the bones to rub against each other. When this cartilage is the intervertebral disc, the cartilage between each vertebra, it is known as spondylosis. When the bones rub against each other, the bone creates more bone, known as bone spurs, which grows into the spinal canal. These bone spurs are what cause the constriction of the spinal cord.